Let me begin the session by acknowledging the various roles that registered psychotherapists assume within our healthcare system and the pressures that they face, particularly as we look at how healthcare must be rethought as we navigate to effectively deliver our services across the province during this extraordinary time. Self-regulation allows healthcare colleges the privilege and the responsibility to regulate their members. Professional self-regulation provides the scaffolding for a sustainable profession in an increasingly complex delivery system. This includes a system with clients whose needs are more acute, a system where the growing expectation is that care will be delivered in the community, except for in the most extreme cases, a system where registered psychotherapists are working with other providers, either as a formal part of a team or as a part of the broader circle of care, and a system where managing health benefits or third-party coverage, dealing with risk management and the business of providing care requires many RPs to be entrepreneurs as well as clinicians. So today we have 2 hours, and we are hoping that we can spend as much time hearing from you as possible. As you can see, we will be providing updates on the work of the college and responding to issues that you identified as being of concern to you in the registration poll. Then we will open the video conference to hear from members about issues facing the profession that the college should know about. This is part of ongoing work to inform regulation with frontline perspective. Finally, we'll do a quick wrap up to let you know what's coming up for the college before signing off. So I'm going to hand the platform over to Deb, who will provide updates on a number of items. The updates she will be providing are based on what the college is hearing from registrants in the course of our work, through frequent questions to our info mailbox and phone line, through queries to our practice advisors, and in the surveys you completed before this town hall. So I'll pass it over to you, Deb.
Thank you, Shelley. Hello, everybody. I'm also happy to have the ability to connect with you today. I would very much have preferred it to have been in person. And so I particularly appreciate that everyone's adding 2 more hours of video conferencing to your already busy schedules. Just by way of housekeeping, I wanted to note that we will be sending out an evaluation after today's town hall to invite your feedback on the meeting and to help shape our future town halls as we go forward. We'll provide you with links to any resources that I or Shelley mention when we send out the evaluation link, so you don't need to worry about looking for those. We'll make sure they're front and center. And I just wanted to reiterate Amy's request that you type your questions into the chat feature as you actually think of your questions or as they come up for you, so that we can answer as many of them as we possibly can in the second hour of the presentation. So I want to start with some very general updates. Our registration team continues to be really busy, which is great news as it signals the continued growth of the profession across the board. Applications for registration are coming in at about 100 a month, and it hasn't really slowed down since the pandemic started, which is reassuring. As of March 31st, 2020, when these numbers that you see here were polled, we had 7,387 registrants. By September 15th, when we finalized these slides, that number had grown to 7,833. So it's going fast. Approximately half of the applications we receive come from graduates of the 19 recognized programs and 1 accepted bridging program that we have on board. We continue to run the review and recognition program so that schools can be recognized as they're ready to. That's a voluntary piece that programs can decide to participate in. And registrants continue to pass the entry to practice exam at a very solid rate of about 84% over the last 2 sittings. Just by way of a quick COVID update, we're in constant contact with our third-party exam administrator in relation to the restrictions and the occupancy and exam site venues because of the pandemic. While we very much want to see the exam go forward in October, obviously we'll need to abide by any restrictions and requirements that public health puts in place. And so we remain watchful as the situation develops further. We're communicating a lot with applicants and, with registrants, and we'll continue to do that. Also wanted to note sort of some of the spread of registrants across the province. Since March 31st, again, when the stats were pulled, we've added 53 new registrants to Northern Ontario for a total of 790 RPs practicing in the northern part of the province. Across the rest, we have in the west, 1,150, in the east, 1,393, Central East, 871, Southwest, 709, Central West, 378, and Central, 2,401. Those numbers continue to grow, as I said. Certainly the Central West District and the small number there is something that we've been watching in terms of the growth of the profession and the needs of the population in that community. We'll talk a little more about that later. Again, from the slide, you can see that about 85% of RPs identify as women. And I just wanted to note that we added a third gender option to the renewal form last year. And while CRPO was happy to be able to do this, to allow all of our registrants see themselves represented in the numbers, it's still not possible for us to report this to the Ministry of Health when we provide our annual Health Human Database submission. We have been advocating for them to update the database, but that hasn't happened yet. I just want to note that all the stats that I provided here are available in our annual report and they're online. So if anybody wanted to refer back or see them in any more detail, please, we encourage you to take a look at that. Just wanted to sort of move through the process. So moving on from registration to quality assurance program. As you know, this ensures the continuing competence of all registrants, and it is a mandated part of the college's work through the Regulated Health Professions Act. As we continue to focus more on right touch approach, which is something I'll speak to, we'll be looking at how the QA program components can be best utilized to support you in your efforts, your professional development efforts, and your continuing competence work. As you likely know, the QA program currently consists of those 3 steps: the ongoing participation in professional development, and then the 2 steps of peer and practice review. We'll be looking closely at these components over the coming year to ensure that we are using a right touch approach to the proactive end of regulation that we're committed to working on. So you can expect to hear from us as we consult with registrants about professional development over the coming months. Our practice advisory service continues to be really well utilized. The service, which provides information to the public and registrants related to standards and professional practice, responded to 1,650 inquiries over the course of the year. So really busy. We have a committed group of practice advisors who are your peers, who are well-trained and understand the standards. They are there and available to you. I would encourage you to use this service to assist you whenever you have questions or dilemmas about the standards. For the college, this service is one mechanism that helps us to identify and stay abreast of developments in the field. We hear from you, in the immediate, and it's a good source for us to look at higher level themes and trends, to direct the work of council and committees, and to contribute to policy and resource development. Questions related to COVID-19, the related restrictions, electronic practice and e-therapy, as well as return to in-person practice and the infection prevention and control measures were understandably frequent over the last quarter. You can see here on the screen, I hope, the additional themes. And I think the piece to note here is that some of these themes are really frequent flyers. From one year to the next, we see them across all functions of the college. And so we want to provide a bit more information today about the work that we're doing in response to them, just to dig in a little bit and try and provide some sort of more current information. One of the things in response to the pieces or the information that we're seeing through our data mining is that there is a real complexity to informed consent. And so we've launched a pilot of a project called the Peer Circles Initiative. This is a group-based learning experience. It brings RPs together for a deep collaborative exchange of knowledge to support complex decision-making within the legal and regulatory framework. So one of the things that we know is that you're all very good at undertaking education related to your modality, to emerging trends in the mental health landscape, but we wanted to be able to offer something that's very regulatory specific. So we've worked with several of the professional associations over the last months to train peer facilitators. who will be able to run these circles at conferences or a standalone workshop. This year, we've chosen, as I said, to look at the informed consent issue, which allows us to address things such as disclosure of personal health information, the consent of minors in the context of divorce and separation, and record keeping. I can tell you that we hear questions about this at the proactive end in the practice inquiry. We see registrants struggling with it in the quality assurance program. And unfortunately, it's a theme that does come out in our complaints department. So we hope you'll consider attending a peer circle event. We will be running them over the course of the winter as well as in next spring. Our first one is actually next week at the OAMHP conference. It's already at capacity, which is great. I'm very excited to see that. For now, the events will be run obviously as virtual events. We'd always intended to expand into that realm. We just had to flip it and start with that instead. We'll return to in-person as soon as it's safe to do so. I also want to address complaints and reports. So the college is aware that as a relatively new regulator, we need to communicate with registrants proactively about what to expect if they receive a complaint. So I'd like to offer a few statistics and answer any questions if you want to enter them in that chat field that you might have about this part of our regulatory mandate. Just in terms of the numbers, last year we saw 72 new matters before ICRC, Inquiries, Complaints, Reports Committee. 61 were complaints, which means that they are from the public about care, and 11 registrars' investigations, which resulted from reports, so typically reports from other professionals. Of the complaint and report decisions that were issued in the last fiscal year, no action was taken in 15 cases. So it was deemed that the risk to the public was not a concern, and so no action was taken. 15 registrants received written advice. 4 members entered into remedial agreements where they had work that they had to undertake in order to continue to practice. 5 received in-person cautions from members of the ICRC committee. 16 were required to complete a specified continuing education and remediation program, otherwise known as a SCRP, and only 7 of those cases were referred to discipline. So we'll keep providing these numbers so that you can see the progress. Certainly, whenever there's a discipline hearing, it is posted. The notice of allegations and the decision reached by the committee are posted on the website. And so there's something that if you care to take a look, you can see where registrants ran into trouble and how that was disposed of by the college through discipline. This slide is actually a complete repeat from previous presentations, but I think it's important enough to share this again since it really is about the philosophy that underpins our work. So what is right touch regulation? For anybody who hasn't seen this before, it's discouraging the use of regulation if the risk can be addressed more effectively by the professionals themselves. So it encourages the use of regulatory measures that support positive behavior changes, the exercise of professional judgment, and does this rather than seeking to be overly prescriptive. So it really does set the scene for some of the upcoming work that I want to talk about today. What it means in practical terms and using that right touch professional standards authority philosophy is that we identify the problem before the solution. We quantify and qualify the risks. We get as close to the problem as possible, which is why we need to come to registrants to hear what you have to say about what constitutes an issue around being able to practice safely and ethically. We focus on the outcome. So what is it that we can do to make things better? And we use regulation only when necessary. Above all, we keep it simple. We check for unintended consequences, and we review and respond to change. So the whole point of the right touch regulation approach is that we really, get out of the monolithic, this is the way we do things, and we end up in a position where we're able to.
You're muted.
No, I wasn't. Am I back? Yep, thank you. Sorry, I wasn't showing up as muted. Thank you. So we keep it simple. We check for unintended consequences, and we review and respond to change. One of the direct responses to the right touch approach this year is a pilot project that our Deputy Registrar and General Counsel Mark Pioro will be running. It's a pilot that looks at the regulatory problem identification process. So it really does give us an opportunity to take the right touch approach into a practical realm by focusing on issues where harm is likely to occur. So we're looking at Professor Malcolm Sparrow's work, and I've got his book cover up there if anybody's really interested in reading that stuff, on regulatory reform, and his really wonderfully simple prescription that regulators should pick important problems and fix them. So sounds really simple. The important part is that it provides a framework that will allow us to engage with stakeholders, including and in particular with registrants who, as I said, are close to issues that may warrant regulatory intervention. We've posted, or we will post, a problem nomination form on our website, and we'll be communicating about it so you know it's there. And I'd encourage you to look at it and use it if you want to identify a regulatory issue that you feel needs to be raised for consideration. We'll be reviewing the nomination forms on a regular basis to help us identify potential interventions, which could range from policy changes, quality assurance resource development, council continuing education, the whole sort of realm of regulatory tools. And we're very keen to have your input, and we'll be promoting that pilot over the coming months. So as I said, please do look out for that. Also, I wanted to just talk a little bit about our strategic plan, which is posted on the website. This time last year, College Council met for a full day to develop a 3-year strategic plan. The priorities that you see identified here on the screen were informed by a full governance review that was completed in June 2019, and the report from that is also posted. Emerging direction from the Ministry of Health related to a really comprehensive regulatory college performance management framework that they've started to implement, along with issues that Council identified in reviewing the work across the college functions within the regulatory environment and in the province's healthcare system. Work plans have been developed for the committees and staff, and they'll actually be tabled tomorrow at the council meeting, where we'll be asking for full approval, and they'll be posted on the website afterwards. As part of strategic planning process, Council developed and adopted a set of clearly articulated regulatory objectives. And there are a couple of reasons why I'm presenting them today and why they're important, and I think that they're worth taking a bit of time to discuss. First of all, for clarity and understanding. Establishing and communicating regulatory objectives really allows a regulator to tell registrants and the public both what they do and how they do it. Helps to sort of pull the curtain back and explain in a very transparent way what the mandate is and how we're carrying that out. Stated objectives also support accountability. Within that right touch framework that I was talking about, if an initiative cannot be measured against one of these objectives, it likely shouldn't be undertaken. So it really gives us the boundaries within which we're operating and makes them clear to you as well. So we're going to be using these objectives across council and committee work to ensure alignment both with the Regulated Health Professions Act, that mandate of public protection, and with our identified strategic priorities. We'll be using this really practical tool that I've got posted up here on the screen. It's just a series of questions, nothing complicated, but used in conjunction with the regulatory objectives. They guide council in determining to what degree any proposed initiative measures up against that public interest mandate. As I noted in the last slide, if an initiative can't be measured against one of the objectives, council won't be dealing with it. This is one of the places where, again, we can underscore the distinction between the mandate of the regulator and the mandate of the associations, which work for the protection of the registrant versus public protection. But I think that in many instances, if you're sort of keen and engaged with your association, you'll see where the work that the college is doing, and I'm going to talk a little bit about that later, but you'll see where the work that the college is doing is complementary to the work that the associations do. So now I want to hand the virtual mic back to Shelley. She's going to update you on the college's response and ongoing work from a very regulatory perspective to address systemic racism.
Thanks, Deb. So Speaking to the strategic objective of providing equality, diversity, and inclusion in the provision of psychotherapy services, I recognize that this is a very text-heavy slide, and apologies for that, but I really wanted to have the full objective screen for you to read. I think I just maybe want to give you just a moment just to kind of read over what's been written. So this objective was adopted by Council in January as part of a broader conversation about how to ensure that CRPO was regulating in a responsive and effective way. Our governance review, as Deb discussed earlier, identified the lack of diversity at the Council table and challenged us to consider what this meant in terms of our ability to protect the public in a way that took into account the issues that members of BIPOC and other equity-seeking communities face in accessing care in Ontario, particularly, and in our case, mental health care. So what does this look like in practical terms? We have developed competency and composition matrices which look at the mix of skills, experience, and attributes, including lived experience from these communities and variation in practice setting and modality. We have the ability to appoint professional members to committees outside the election process. We have done this using the above criteria, and tomorrow Council will be asked to make 8 appointments that will see a much more diverse representation of racialized RPs, as well as practice setting and modality around the table. We pulled case examples accompanying our guidelines on disclosing information to prevent harm because they included calling 911 or the police about a client who is in crisis. To be clear, the guiding principle is to balance client autonomy with the need to prevent harm to the client or others. How that plays out depends on the situation. We will be reviewing and revising the guideline to provide more clarity as to whether a registrant is required or to involve police or call 911 for clients who are in crisis, and to provide other guiding resources and options instead. We are ensuring BIPOC RPs are at the table for the work of standards review so that the process considers the needs of racialized clients, families, and the therapists who serve them. As a starting point to the review, Council will be asked to consider the following. Do the CRPO standards adequately and appropriately contemplate the provision of service to racialized clients? How can CRPO ensure that any required updates or revisions are well informed by the perspective of racialized clients and RPs? Over the coming months, virtual consultations will be used to determine how the perspective of BIPOC clients and those from other equity-seeking communities can best be sought out and included in the response that will shape our public information shared going forward. Within the scope of the regulatory role, we are working to consider how to be a more effective contributor to Ontario's mental health system. At a time when systemic change is clearly necessary, we are aiming to work in collaboration with other stakeholders to ensure that the people of Ontario have adequate access to skilled registered psychotherapists. This work is in its early stages, but we are committed to engaging with members of BIPOC and other equity-seeking communities, including RPs from these groups. Finally, we don't know what we don't track. So CRPO does not have a method of knowing how many BIPOC registrants we have and if they face barriers in regulatory processes. As such, we are looking at implementing a mechanism for RPs to volunteer their racial identification during the renewal process. Rest assured, input from racialized RPs will be sought on this manner.
So thank you again for completing the survey when you registered for today's meeting. We were able to see clear themes based on your responses, and we want to respond to spend some time responding and providing information and then take questions from you. So if there's anything we don't answer over the course of the next half dozen slides or so, please make sure you put them in that chat function. As a starting point, I'd like to just offer the following. The issues you raised are, for the most part, very much on our radar. we'll be feeding these issues into our regulatory problem identification and the rest of the work that we do, so that the weight of registrant concerns can be considered in how we move forward. Many of the issues are system level. So for instance, the lack of resources faced by many, in fact, communities. And so our work on being a more effective system partner will be very relevant on a number of these fronts. So we asked you, what issues do you face in providing safe and ethical care? Definitely at this time, the most frequent identified barrier to providing that care was the pandemic. It included infection and prevention control measures that registrants are finding difficult or onerous to implement, particularly for practitioners who work with children or with a modality that involves something other than or in addition to talk therapy. Concerns about personal health or the health of family members who might be vulnerable, definitely heard that loud and clear. Struggles with e-therapy platforms, and misalignment between policies and measures implemented by employers or required by employers, and the approach that registrants would prefer to take or that the college is asking them to take. We'll continue to monitor the information, which is coming fast and furious from government and from public health, and to provide resources to registrants. And I'm going to talk specifically about COVID-19 in a few slides. You also shared ongoing concerns around the lack of third-party insurance coverage. We see this as still an underlying theme on a number of fronts, particularly as it relates to your client's ability to access and afford care. While I can't underscore enough that this issue is not one where CRPO has any authority or any official role or direct role, we continue to make sure that we provide timely and accurate information to any inquiries that we receive from insurance companies, and we take every opportunity we can to educate them. The fact that RPs are regulated in Ontario and in a growing number of provinces and are therefore an accountable group of professionals is the key message that we need insurers to hear, and one that we repeat as often as we have the opportunity. The other key issues that were threads in your responses to questions about your region were systemic issues. Issues such as the growing complexity of issues with which your clients present, in particular addictions and trauma, and the lack of system resources for clients with complex needs. We also heard about practice issues such as managing technology and the privacy concerns that accompany its use, which I'll speak to again in a couple of slides. Overwhelmingly, flicked through the wrong slide. Overwhelmingly, the barriers identified to clients were systemic. Lack of community resources for referral or general support, economic barriers because RP services remain for the most part outside publicly funded services, other related economic barriers such as the lack of public transit to attend appointments. I was shocked when I did the word cloud. Initially, bus and transit came up as just a huge piece of this, and so we sort of bundled that into the economic barriers. The college will be actively engaging and looking at these barriers from a regulatory perspective. Interestingly, the ministry for the first time has included measures of how regulatory colleges participate as system partners in their recently developed performance management framework. And it's our college's intent to use this as an opportunity to play a more involved role in the question of these barriers. As Shelley mentioned in her opening remarks, we will be holding public consultations on the college's engagement with clients and the general public over the coming year. We want their input on what information we share, how we share it, and the lens for these consultations will be very clearly focused on equity and access. Finally, and similarly, your regional specific issues were largely systemic. I've mentioned the key themes already, so I won't repeat them, but I wanted to underscore that we've also taken steps from a governance perspective, again, as Shelley noted in her opening remarks. In particular, we're really keen to be adding to our committee tables in order to be able to look at those issues with that more diverse lens, both in terms of the racialized RPs, their modality of practice, and their community and setting of practice. These appointments will actually be made tomorrow at the council meeting. They're a critical step in the college's efforts around governance improvement. And if you aren't watching the meeting tomorrow afternoon, I would encourage you to take a look at council highlights afterwards to see who we've appointed and the work that we're going to be asking them to do. So COVID, do I sound as bored of talking about this as everybody is of thinking about it? I'm sure you guys are inundated with information on the pandemic. So I will be as brief as I can today, but I'm happy to answer any questions if you want to put them in the chat. As you likely know, college operations went remote on March 19th. Since then, staff and committee and council have continued to operate from home offices using video conferencing technology. Our efforts were focused on ensuring that we were providing registrants with accurate information regarding practice restrictions dictated by the Chief Medical Officer's Health and guidance on the use of e-therapy practice and safe return to in-person practice. Prompt response to specific practice inquiries, and we had lots around issues such as confidentiality and contact tracing. What do I do if I'm contacted by a public health official about a client I've seen who's tested positive? Infection and prevention control measures, and mandatory mask orders. We've been continuing to register new applicants in a timely manner. We don't want to hold up people who are making their entrance into the profession at a time when, you know, they're probably battling some pretty significant uphill issues in terms of getting to work. We've been managing the entry to practice exam delay that I mentioned, deferring renewal payment dates at the beginning of the fiscal year in March, and of course, continuing to respond to questions, complaints, and the concerns from the public. We've actually been holding virtual hearings in order to continue this work. At this time, we're watching the situation closely. It's shifting again, as you know. I attend the Emergency Operations Center briefings held by the Ministry of Health so that I can hear in real time the latest news and get answers to questions that we have had or that we anticipate from registrants. And we'll continue to do this and provide information as it becomes available, with a focus on interpreting any of those directives that come forward and what they mean for the practice of psychotherapy. And also, I want to just take a moment and actually acknowledge how hard everyone is working. We are acutely aware. We see the strain that the pandemic is taking on everyone's well-being and for many on their mental health. And we know that you're, as regulated professionals, as registered psychotherapists, striving to meet the needs of your clients, whether you're doing it through a virtual a platform or in-person therapy with the appropriate infection and prevention control measures in place, while balancing the need for your own health and safety. So I wanted to really acknowledge that we see that. We know that frontline work is what you're doing and that it's not easy. And for the college's part, we will continue to work hard to provide appropriate support to allow you to continue to be able to work and to provide safe and ethical care to clients at a time when they really need it. Clinical supervision continues to be one of those frequent flyer issues, raises questions for a number of registrants. The questions that we see around clinical supervision encompass hours and type of supervision, supervision of the controlled act, supervision by members of another regulatory college, and billing for supervised services. In response, we've taken a number of steps to provide clarity. And I'm going to be very upfront with you. I'm going to read these. They are very technical and pretty dry. I want to make sure I get it right. And again, I note that all this information is on the website. So making sure that if you want to have a look at it, we will make sure we highlight it in the evaluation link. So as you all likely know, there are two types of clinical supervision that can be reported to CRPO for registration purposes: individual and dyadic, and then group or structured peer group. Clinical structured peer group supervision is where there isn't one leader, but there is at least one member of the group who meets CRPO's clinical supervisor criteria. It must be formal and structured and meet the definition of clinical supervision in order to be counted for registration purposes. Informal peer supervision, that is the unstructured discussion of clients with your colleagues, sounding ideas off colleagues is not considered an acceptable form of supervision for registration purposes. We absolutely encourage it, used appropriately, but it doesn't count as those hours. So I want to make sure that all of our qualifying registrants and their supervisors are aware of the requirements related to clinical supervision and to direct client contact. So the requirement to transfer from a registered psychotherapist qualifying, otherwise known as RPQ, to RP is 450 direct client contact hours and 100 clinical supervision hours. The requirement for our independent practice is 1,000 direct client contact hours and 150 clinical supervision. There is no maximum number of individual or dyadic supervision that can be reported. If you wanted it to be full 150, you are quite welcome to do that. At a minimum, 50 of the 100 clinical supervision hours required to transfer from RPQ to full RP, and 75 of the 150 clinical supervision hours required from RP to RP independent practice must be individual or dyadic supervision. The remaining hours can be group, structured peer group, but there are restrictions on the number of supervisees in the group. So we're changing that, and this is the piece that I'd like to highlight. Until March 31st, 2022, so for another 2 years, or not quite 2 years, up to 20% of reported group supervision hours, so a maximum of 30, can be completed in a group of 9 to 12 participants, provided that the clinical supervisor attests that the learning is promoted for all supervisees in the group. So you need that supervisor attestation form that we have. All the remaining reported group supervision hours can include up to 8 supervisees. Research shows that group size no larger than 8 supervisees is most effective. The college has done their homework and made this change accordingly. So starting in on April 1st of 2022, only group supervision with up to 8 supervisees will be accepted. So that's a bit of a shift. All this is posted, and again, we'll make sure to highlight it so that it's there, but I wanted to really take the time to walk you through it. I hope I haven't lost everybody. The Controlled Act, it's interesting. I feel like we spent 2 years talking about not much besides that, but we've really only heard from a very few registrants who saw issues related to scope of practice, employment roles, and continuity of care. These were the issues that we were anticipating in advance of the proclamation of the Act. They have come up, but not in huge numbers. The most significant, I would suggest, practical impact that we saw was around clinical supervision. While questions related to that issue have kind of dropped off, we still hear from people about who can supervise whom. And so I thought it was worth just pointing to the clinical supervision FAQ that's posted on the website. Again, it will be in the links. And as a reminder, that there are restrictions around the clinical supervision of the Controlled Act for students. So those who are planning to enter the profession and intending to join CRPO need to be supervised by an RP in order to perform the Controlled Act of psychotherapy as part of their education. And that comes directly from the Regulated Health Professions Act, so from our authorizing legislation. And that RP supervisor must meet CRPO's definition of clinical supervisor. Once an individual is a member of a regulated health profession, even as an RPQ, they have access to the Controlled Act and they can be supervised by members of another profession if that's what's appropriate for them, provided that they meet the supervisor criteria for the purposes of registration. The Controlled Act documents are there, the self-assessment is there, along with the accompanying suite of documents that we developed a couple years ago. If you have any questions or concerns about the Controlled Act, I'd encourage you to consult them, but then to follow up with us if anything remains. Electronic practice is another one of our frequent flyer issues, and we received a considerable number of inquiries about electronic practice as registrants very quickly moved their practice to online when the pandemic hit and the restrictions to in-person services were put in place. We provided resources through March and April and May to assist with this. They're posted online on the FAQ page and are available if anybody needs them. The feedback that registrants provided to the guidance documents that we developed to assist with return to in-person practice allowed us to develop a comprehensive list of places where registrants are struggling, and definitely e-therapy was one of them. We're actually looking at developing a webinar for registrants to try to deal with some of the practical issues that we hear you are still concerned about, such as assessment of new clients, supporting clients who struggle with using a virtual in that area, and hope to put that out soon. Please stay tuned. If you have issues that you would like addressed, this is one of those places where practice at crpo.ca is a real resource, and I would encourage you to reach out if you need any assistance on that front.